Welcome back to WMBC News. Sneezing, runny nose, and watery eyes are symptoms that you may be familiar with. With cooler temperatures rolling in, so is the fall allergy season. Joining me today is Dr. Deborah Geller. She's a board-certified physician specializing in asthma, allergy, and immunology. Dr. Geller, thank you so much for being here.
Oh, thank you for having me.
So decongestants and antihistamines are what most allergy sufferers turn to because they're over-the-counter, they're readily available. But sometimes that's not enough, and there's a higher level of treatment that is available. It's called immunotherapy. Mm-hmm. What is it and how does it work?
So immunotherapy, there is subcutaneous through an injection, or there are tablets that are available where we give patients the allergen that they're allergic to over a period of time, in essence to desensitize them, so that over time they're less allergic.
And that seems kind of dangerous because you're introducing an allergen to one who is allergic to that allergen, if that makes sense. Are there any precautions? How do you avoid an anaphylactic reaction?
So yes, it can be dangerous if it's not done properly. So yes, you want to be able to, you want to do it in an observed setting. At least the subcutaneous, the injectable form is recommended to be done in an observed setting, which is typically in a doctor's office. You want to know, is the patient having any problems before they get their injection? Are they having any medical symptoms, whether allergy or illness, before giving them their injection? They need to be monitored afterwards to make sure they're not having any symptoms after their injection. And you want to make sure that you have in the office the supplies needed to treat a reaction if need be. So yes, it can be, but if it's done properly, then it is safe.
And what kind of allergies is immunotherapy indicated for?
For right now, we have immunotherapy available for environmental allergens, both indoor and outdoor. Seasonally, I'm talking about tree pollen, grasses, weeds, molds. And then there's the indoor allergens that people react to, such as animal dander, cats, dogs, dust mites. But you can do it for a lot of different things, but those are the most common ones.
And who is a good candidate for an immunotherapy?
I would say patients who have failed traditional therapy, meaning medicines that you can get both over-the-counter and prescription. Some patients would rather do immunotherapy than take medications as well, so that's a choice, that's an option. And certainly patients who are having more significant symptoms than what the medications are managing.
And you mentioned immunotherapy comes in different forms, tablets versus injections. Now, is this something that patients can do themselves at home, or is it something that they have to visit a doctor for?
To start off with, yes, they need to visit a doctor because it needs to be prescribed. Immunotherapy through injection, that is recommended to be done in an office setting, a doctor's office setting. The tablets have been made to be given at home, so that is something that is a possibility, but there are only a few allergens that are available through tablet form, so it does limit what one can be treated with in the tablet form.
And how long does it take for immunotherapy to work?
Some people may see a positive response sooner than others. I tell patients, at least with the injectable form, 6 months, 9 months, because it takes time to build up that, or to desensitize and build up their tolerance. And then with time, they need to stay on it for maintenance. But I usually say within 6 months to 9 months.
Do you do a skin test before you introduce the allergen to the patient?
You need to do some form of allergy testing. There are different ways of doing allergy testing. Skin testing is most common, but allergy blood testing is very common as well. I use both depending on the scenario and the situation.
And what are some allergy lifestyle management you would recommend?
For indoor allergies, whether dust mites, animal dander, simple things, dusting, changing your filters on your heating system, air conditioning systems. If you have pets at home, minimizing them coming into your bedroom is a good first line of defense. In terms of outdoor allergies, making sure you change your clothes when you get home, take a shower, keeping the windows closed, air conditioning on, similar as with the indoor in terms of changing filters. So those are some basic environmental precautions that I typically recommend.
That is some really good information. Thank you so much, Dr. Deborah Geller. WMBC News will be right back.